This is Kawasaki disease, a rare condition you may have heard of in recent months because of its possible link to the coronavirus. A number of children diagnosed with COVID 19 have been showing symptoms that resemble it, including rashes and inflammation. This is what it looks like on white skin. But this is how it presents itself on darker skin, a lot more subtle.
There is a white skin bias that currently exists.
That's Malone Mukwende, a second-year medical student at George's University of London who noticed early on in his med school training the lack of racial diversity in his textbooks.
Growing up, I would hear about or see people who have been misdiagnosed and people who just had a lack of trust in their healthcare service. And I could see that this was very problematic because it would lead to some people even presenting to seek medical advice a lot later. And then going to medical school, it made me realize that, oh, in medical school from a grassroots level, we're not even taught about these things.
That's why he helped create a handbook of clinical signs in black and brown skin called Mind the Gap.
Even in countries where Black people are majority, they are still learning in medical school from textbooks which have white skin as a reference. So one could argue that historically that the books were written almost for white people and they didn't really accommodate for everyone else because that's the pictures that we see in the book.
A concern that is echoed among many throughout the medical community. A recent research letter in the British Journal of Dermatology found that out of 36 studies showing images of COVID 19 presentations on skin published between December 2019 to May 2020, there were 0 images of dark skin tones. Particularly shocking because of the fact that COVID 19 is disproportionately impacting communities of color. COVID toes is another symptom that has been reported in some patients with the novel coronavirus. But even a quick Google search will show it on mostly light skin. COVID 19 is just the latest example showing the lack of representation in medical literature. When you flip through most medical textbooks, the majority of the images, if not all, are of Caucasian skin. In fact, an analysis of textbooks done by the University of Pennsylvania showed many dermatology textbooks had no photos of dark skin with acne, psoriasis, or dermatitis.
What we found is that there isn't much of a difference compared to 13 years ago. The same relatively low number of representation exists. However, it's not across the board. For instance, with sexually transmitted infections like syphilis, dark skin types are quite overrepresented disproportionately. And that's concerning because it brings up concerns about bias in when certain skin types are used for representation, which may play into long-standing racist stereotypes.
At the Skin of Color Society, a team of dermatologists has been working for decades to educate others on how to treat patients of color and push research and clinical trials to include people with darker skin.
We have been working on at the Skin of Color Society visual clinical images of how we can train residents systematically to say, this is a skin cancer in an African American person, that same skin cancer in an Indian patient, or in a patient of Hispanic origin or in a patient of Caucasian origin, this is how it looks. And this is why you need to be able to diagnose that skin cancer and save that patient's life earlier on.
It's not just the lack of representation in the images that are problematic. Some of the terminology like ethnic skin and ethnic hair otherize people with darker skin. And terms used to describe symptoms like blue lips, pale skin, or red rash don't often apply to non-white patients.
Instead of looking red, as the textbook says, it can actually look sometimes purple, sometimes brown, sometimes a little bit gray. So assessing our disease is different and treating it is different. So patients with darker skin are more likely to have what we call pigment incontinence. So essentially, after a rash or some trauma, we can have significantly and long-lasting dyspigmentation or darkening skin that can be really disfiguring for many folks. So that should be considered when choosing different treatments. So besides diagnosing and defining disease and assessing how bad it is or isn't, treating disease also has important considerations.
Healthcare professionals aren't the only ones pushing for change. This Instagram account was created by a mom in North Carolina after she noticed the absence of resources available online. With over 60,000 followers, it collects community-sourced images of dermatological conditions on non-white skin. More proof that health gaps do exist and a much-needed reckoning is underway so communities of color can be better treated. Thanks for watching Global News. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel.